Hi everyone, I am Aida Arosoaie, a third-year student in cultural anthropology, and I explore the local socio-ecological specificities of zoonotic diseases. According to the World Health Organization, a zoonosis is an infectious disease that has jumped from a non-human animal to humans. Zoonotic pathogens may be bacterial, viral, or parasitic, or may involve unconventional agents and can spread to humans through direct contact or through food, water, or the environment. They are considered a major public health problem around the world due to the close relationship between humans and animals as agriculture, as companions, and in the natural environment more broadly. Zoonosis can also cause disruption in the production and trade of animal products for food and other uses. Examples of zoonotic pathogens include the HIV, which began as a zoonosis but later mutated into human-only strains, the Ebola virus, or the novel coronavirus that causes COVID-19, as well as parasites such as the Plasmodium parasite, which causes malaria. The One Health framework ranked zoonosis as a critical threat to global health and human security. While prevention methods for zoonotic diseases differ for each pathogen, standard health protocols for zoonotic disease prevention focus on personal and environmental hygiene practices and safety guidelines for livestock care. At present, one of the fundamental paradigms of the zoonotic disease prevention is the emergence framework, which looks at the relation between humans and the animal and marks the spillover event, namely, the moment or context of virus transfer from the animal to the human. Yet the focus on the spillover event often approaches zoonotic diseases as decontextualized phenomena. As many scholars have argued, the One Health framework, as well as conventional global health approaches, tend to address interspecies relations as pathologies, marking these into the narrow categories of positive or negative. This approach, which focuses on safe and sustainable interspecies relationships, has been interpreted by some scholars as a rather neo-colonial take on interspecies relation, effectively consolidating species taxonomies and the configuration of global health, misinterpreting webs of causality, and rendering sociopolitical hierarchies invisible. My research aims to contribute to these already existing critical approaches by focusing on local biologies and ecologies that underscore multiple origins and entangled webs of causality or conditions of possibility for the development of zoonotic diseases. My anthropological research in Indonesia, on the island of Sumatra, investigates the process of relocation of formerly dwelling communities in the context of deforestation and the extension of industrial monocrop plantations. I seek to understand how land use change reconfigures interspecies relations in ways that enable the transmission of zoonotic pathogens. I hope to capture the key local, economic, political, and environmental factors that place both humans and animals in precarious positions and that orient or sustain relationships that would encourage the transmission of pathogens. While scientists have shown the link between deforestation and zoonotic disease, my research hopes to capture the processes that help materialize zoonotic pathways of transmission. I focus, for example, on changing dietary practices and resource management, the adoption of new economic activities such as agriculture or wage employment, and emerging patterns of settlement along the forest edges. I also aim to understand how the process of relocation mediates culturally contingent notions of interspecies relations in ways that enable or prevent zoonotic entanglements. At the heart of my research lies a social justice-informed approach to planetary health. A critical aspect of my research investigates how the racialized contingencies of capitalist extraction, in this context deforestation and the expansion of monocrop plantations, contribute to the sustained precarity of local populations and actively enable the transmission of zoonotic pathogens. I'm looking forward to conducting my ethnographic research on the island of Sumatra in Indonesia, and I'm very grateful for the financial support I received from the Global Health Institute, which will make my research possible. Thank you.